Wonderful. So welcome everyone to today's Tuesday Times Roundtable. Today's topic is the fight against tuberculosis following the World Tuberculosis Day this past March 24, 2025. The Tuesday Times Roundtable is the Office of Global Learning Initiative's flagship discussion series that brings together multiple perspectives on current global issues and trends. And we also connect them to the United Nations Sustainable Development Goals. If you would like to learn more about TTR, you may go to go.fiu.edu/TTR. Please take a moment to sign in using the QR code or the link in the chat. This is the way how we're going to be reporting your attendance. And the sign-in closes at 1 p.m. So make sure that you do it at this moment. So whether you're here for Global Learning Medallion points or Honors College engagement points or extra credit from your professor, whatever brought you to us, we are happy that you're here. My name is Karyne Mendoza Farjon, and I am the Senior Program Coordinator here at the Office of Global Learning Initiatives. A big thank you to our staff as well. We do have Assistant Director of Global Learning, Michelle Saldivar, here with us today, and our wonderful graduate assistants, Natalia and Gitanjali. Our team will be monitoring the chat, so if you come around questions that you would like to ask our panelists today, just make sure that you put them in the chat, and we'll make sure to forward over to them. All right, so if you would like to learn more about global learning and also all the initiatives that we have in our office, make sure that you visit goglobal.fiu.edu/students. This includes the Global Learning Medallion Program, Millennium Fellowship, Peace Corps Prep, and also scholarships and fellowships that we have within our office. The TTR sessions are always a one-point opportunity for the Global Learning Medallion students, so make sure that you do a screenshot of your sign-in so you can put it in your activities log. You may also follow us in Instagram so you can learn more about the initiatives and also stay engaged in our social media platforms. Also, you may join the FIU College of Law on April 8, which is next Tuesday, on a discussions on Florida's modern death penalty. This is a one-point opportunity for Global Learning Medallion students, and if you would like to sign up, feel free to scan the QR code on the screen. And every TTR session is always centered on a global issue or trend, and it's always linked to a news article. Today's session, you may access it at go.fiu.edu/TTR0401. And this is because FIU has an official partnership with the New York Times that provides digital access to everyone with an FIU email account. So you may activate your account at accessnyt.com. Today's session also relates to SDG number 3, good health and well-being by ensuring healthy lives and promoting well-being for all ages. To learn more about this SDG, including the targets, indicators, and the progress on this goal, you may go to go.fiu.edu/SDG. Hi, and now it is my great pleasure to introduce today's moderator, Tenzin Connor, the Senior Associate at the Global Policy for Results. Tenzin serves as a Global Policy Senior Associate in the Results Organization, and he's also a tuberculosis survivor and a proud member of We Are TB. Tenzin strives to contribute to work that strengthens communities and addresses social inequities in health. He has a strong passion for combining affected community narratives with research to offer more nuance in understanding of the lived experiences, empower communities, and power movements. Welcome, Tenzin, to today's Tuesday Times Roundtable. I turn it over to you now.
Thank you so much. Really appreciate the kind introduction. I think we'll actually begin with Karyne, and we'll introduce a bit of what we'll talk about today, but also some background information on Results as an organization. Karyne, over to you.
Thank you, Tenzin, and good afternoon, everyone. My name is Karyne and I'm part of Results' Grassroots Impact team. As mentioned, I'm joined with you today with my colleague Tenzin Kunor of the Results Global Policy team. And we just wanted to share a little bit about ourselves and about Results first. So a little bit about me. I am an FIU Panther. I graduated from FIU with a master's in international business back in 2008. And joined Results as a volunteer with a local chapter in Miami in 2016. Later, it's been almost 4 years, I joined the Results staff as a manager of the Grassroots Impact team in 2021. And what led me to working with advocacy with Results is my background. I'm first generation from Haiti. And I've seen the effects of abject poverty and believe that we can take the steps towards ending poverty through policies to provide access to good health, education, and economic opportunity for the most marginalized, especially in countries with a history of colonialism and exploitation. And this continues to be my why. And with that, I'll pass it over to Tenzin to introduce himself. I think Joneri gave an introduction, but in case you wanted to add anything.
Yeah, I can just share a little bit about how I arrived to work at Results. I actually used to work in education and on college campuses. So was working with different student populations and first generation students, low income students, undocumented students. And previously also worked at dean of students offices and within residence life. So it's good to be talking with college students today and in a campus environment, despite it being virtual. But yeah, it made a transition over to working on global health and advocacy because of my own personal lived experience with TB that set me off on a different trajectory career-wise. But yeah, that's a little bit about me. Look forward to the next hour with you all.
Thank you, Tenzin. So Results is a movement of passionate and committed everyday people who use our voices together to influence the political decisions that'll bring the end to poverty. Results was founded in 1980. We're celebrating our 45th year this year. Since its founding has had a proven approach to being a catalyst for change. The Results policy team researches the root causes of poverty along with proven solutions to address them through policy and funding initiatives for Congress. My team and I support a network of over 500 volunteer advocates in nearly 70 groups across the US, and together we push for policies to dismantle poverty and inequity here in the US as well as globally. And since its founding, Results has mobilized over $200 billion towards anti-poverty efforts. We advocate by deepening our relationships with members of Congress. Regardless of whether or not we voted for them, they work for us in a sense because we are their constituents. And it's up to us to hold them accountable for the legislation needed to alleviate poverty. We do so by writing to members, meeting with members of the House and the Senate. We write letters to the editor and opinion pieces in various publications. And over time, the full network of volunteers has had over 6,500 meetings with members of Congress over 23 congressional terms, has published over 16,000 opinion and media pieces, and has had over 168,000 engagements with members of Congress through meetings, writing letters, and making phone calls. We've transitioned to meeting virtually as well during the pandemic, and we continue to do so to expand our reach. Here's a photo of us with Representative Mari Diaz-Balart, who's the chairman of the House Foreign Operations Subcommittee of Appropriations, which is the committee that decides where our tax dollars go to fund foreign aid programs. And it's often asked why we spend so much on foreign aid. Foreign aid is critical, and as we've witnessed in the last few months, it's often contested. It's a myth that by cutting foreign aid, we would balance the US federal budget. And past reporting from organizations like Concern US show that the average American thinks that we spend about a quarter of our national budget on foreign aid. And on average, foreign aid spending accounts for just over 1% of the federal budget each year. In 2023, it was 1.02%, or $63 billion spent on assistance out of a $6.13 trillion budget. Former Senator Marco Rubio, now our Secretary of State, actually stated in a 2012 speech that we don't have a national debt because of foreign aid. If you zeroed out foreign aid, it would do nothing for debt, but it would be devastating not only to the world, but to America's role in it, which is why it's something that we continue to support. We believe that it's important to ensure funds are spent appropriately and with oversight, and ensure that programs are effective through good faith reforms where needed. We believe in an approach with a scalpel as opposed to a hatchet. Since we last met, there have been devastating cuts to foreign aid, specifically 83% of programs run by USAID, which now runs under the State Department. The consequences in this halt in foreign aid will be 60,000 babies born without not breathing, without being able to be resuscitated, 28,000 people with drug-resistant TB not being able to get life-saving medicine. 7 million children will not be able to get the nutrition they need to grow up healthy and strong, and 3 million women will go into labor with no safe facilities to give birth. And this is according to the Global Health Council impact report. So today we'll be discussing one of these programs, the Global Fund to Fight AIDS, TB, and Malaria, and taking a deeper dive on the fight to end TB. And with that, I'll pass it over to Tenzin.
Thanks, Karyne. All right, so and I'm coming down with a little bit of a cold, so hopefully I'll make it through with no issues. And we'll try to make this as engaging as possible. So any kind of questions or thoughts that come up, please feel free to use the chat, and I'll keep monitoring as well, so can respond to that. So to start, just wanted to provide a brief overview of what we'll discuss today. We'll talk about what the need in the world is and why it's so important, what makes the Global Fund partnership special, why it's so impactful, how it works, and the difference that it makes. And then we'll talk a bit about what's needed in order to secure a strong pledge from the US, but also from others around the world in this really important year. And so we'll talk through all that, but also wanted to ensure that throughout this talk, we'll include specifics about TB, tuberculosis, and just as more of a deep dive into one of the 3 diseases that the Global Fund covers. I think especially by focusing on one of the diseases, we'll be able to better capture some of the impact and also a lot of the challenges that we're seeing in today's world now. Next slide, please. And as far as kind of going over the presentation, I'll use this EPIC framework. And so E for engage, P for the problem, I for informing on the solution, and C as for a call to action. And so this is helpful in terms of any kind of maybe some potential like a lobby meeting, but also hopefully it'll help with just overall talking through the Global Fund and talking through the challenges that we see with TB and global health. Next slide, please. So here's a picture of me. This is early May, as in 2012. I was a senior in college at this time, and just been diagnosed with MDR-TB about a week ago when this picture was taken. And so I was a college student at the time. I was an RA, president of a student org, and just overall probably an overachiever when it comes to student leadership type opportunities. And earlier that year, my senior year, I was experiencing all sorts of chest pains and persistent cough starting from November 2012. And I went to the student health clinic and was misdiagnosed several times. They thought it was maybe a pneumonia or some fungal infection in the lungs. And and they give me some antibiotics, and it would get better for about a week and then get worse again. And this happened for about 6 months until April of 2013. The pain got so bad that I could barely walk, and went back to the clinic. And finally, they suggested a TB test. And so they took a blood test, quantiferon blood test. And a few days later, I was diagnosed with TB. And which, I thought my situation was unique in how long it took. But the more I get to learn about TB, and especially talking with other survivors and patients, it's very common actually to be misdiagnosed and to experience delayed diagnosis. It's a challenge that we see in the world, and it's at the moment quite difficult and even worse. And so that was part of the challenges in the initial diagnosis. And then once I started treatment, went through 4 months of isolation back in my parents' home, and the home that I grew up in Madison, Wisconsin. And the treatment process was just as difficult as the disease, if not more difficult. And that's because it was a really lengthy treatment process of 28 months with over 8,000 pills and all sorts of side effects, from nerve damage in my feet to temporary loss of some visual acuity and hearing as well. And there's a lot of constant, pretty intense nausea that I experienced, and along with some other side effects. And so that, at the time I was grateful to have access to the treatment that I did have, but unfortunately those drugs were incredibly old and outdated in some ways, and especially because I had drug-resistant form of TB. I had to take the second level drugs that were more toxic and had more side effects. So these drugs were from the 60s and 70s, and I didn't have access to, at the time, the newest regimens that are available that cut treatment lengths by quite a bit. And so that was really challenging as well. And so when you think about, all the challenges that go with TB and going through the screening efforts and diagnosis to treatment, and all the impacts that it can have on a person, but also their families. Those are things that we need to consider within our health systems. And so next slide, please. I'll speak a little bit about what the challenges look like at the moment, especially with the funding cuts that we see, and the many program terminations. And so I think Karyne, you had already mentioned about 56, the estimated 56% of funding, US funding for TB programs around the world have been terminated. And so this is having a devastating effect, and these challenges have started from the abrupt withdrawal of funding and the freezes earlier January. And so this is a quote from an interview from a woman in Pakistan. I don't have money to buy medicine. I feel sicker every day. My children are small and they need me to take care of them. I don't know what to do. And so, and then from a partner and actually a dear friend of mine that works in Cambodia, he shared about the challenges that they're going through with the suspension at that time in this interview of funding withdrawals and subsequent program terminations, and what that means on the ground. And so for this particular program, it's meant, over 5,000 community health workers being laid off and unable to carry out the work that they were doing. And so that important work is much more than just diagnosing TB, but and providing access to treatment, but also the treatment support that goes with such difficult experiences with that. And so the community health workers were doing the work on the ground to do community-based interventions around screening, making sure that when people are diagnosed with TB, they're being linked to health centers and the appropriate treatment. And then also, especially for the cases for people with drug-resistant TB, providing treatment support and making sure that they're connected to other services and economic support as well. And whether that's, it can be peer mentoring support to all the kind of support that's needed to successfully complete treatment and improve adherence. And so this is the kind of challenges that we see now. It's quite comprehensive when it comes to what's been impacted for TB programs. And we're seeing a very devastating effect. And that's likely, there's estimates and predictions around increased spread of TB and a surge of drug resistance. So let's go back 23 years from now and look at the Global Fund and its origins. And hopefully it'll be a guide of, what we've accomplished and how we can return to and protect some of the hard-won gains against these diseases. And so back 23 years ago, the AIDS crisis was devastating, and there's so much inequity when you look at the US, Western Europe, and the rest of the world. And so this response came out of this reality that so many people had actually died of HIV/AIDS after life-saving treatment had been invented than before it had been invented. And so that speaks to just the lack of access to life-saving innovations and treatments that people don't have, and it has a lot more to do with has less to do with science, but has a lot more to do with the failure of policy and politics and the general lack of commitment from the global advocates and global health ecosystem at large. And so, yeah, this is at this point, Global Fund had been created. Next slide. We can skip this one as well. And then end up producing so many great results with large impact around the world and a lot of lives saved over the past 2 decades. And so we'll dive a little bit deeper, and hopefully I'll try to close in the next 15-20 minutes, and we can have some room for questions, but I'll have some questions along the way too. So yeah. So looking at, what are the challenges? We started speaking about some of the challenges already and thinking through them. And so more on the problem that we experience, especially with TB. Next slide, please. So what is TB? I think, a lot of times people have these same kind of questions like, oh, it's something from the past, don't think it really exists in the US, or it's not a problem anymore. And people mention that there is a vaccine. And so I'm curious if these are questions that you've had before or have now or have heard from others possibly from others. If there's any other questions or things that come to mind, feel free to comment, but we'll talk a little bit about what the challenges are specifically for TB. And so it is a disease of the past, but also the present. And it's the world's deadliest infectious disease now. It was momentarily replaced by COVID-19, but last year, 2013, TB is again the most deadly disease. And so in 2023, 1.25 million people died of TB, and it sickened 10.8 million people that were newly infected. And in the US, this year, we'll have over 10,000 people sick with TB. And so and that number's actually been climbing since the COVID pandemic. And so it's an example of how TB anywhere in the world is also a threat to the US, and that we're much more interconnected than we would like to think. And so another thing to consider is also as far as latent TB infection. So 1/4 of the world actually has latent TB infection, LTBI, which means that you have the infection, but no symptoms, you're not contagious. But 10% of people with latent TB infection go on to convert to being active. And that's when people experience the symptoms and become infectious if it is in their lungs. And it's a respiratory airborne infectious disease that typically attacks the lungs, but it can also be elsewhere in the body too. So let's have a look at, get an idea of the scale of impact and how old TB is and what it's done over the last 200 years. Next slide, please. So if you, looking at all the deaths combined and across the past 200 or so years, there's been over 1 billion deaths, TB deaths in the world. And so this gives you an idea of just how deadly it's been, and also just highlights how overlooked it is and neglected it's been. So so this might surprise some people, but yeah, this is something important to consider, and it might have to. We can start to. I'd be curious to hear from you all why you think this might be the case that it's been neglected as a disease for quite some time. And I'm getting a question about the vaccines. So there's a TB vaccine. It's called the BCG vaccine. It's about a little over 100 years old. Unfortunately, it doesn't protect adolescents and adults. So for at a very young age, it can provide some protection, but for the most part, it's ineffective as we age. So, for example, I had the BCG vaccine when I was young. I was raised in my first few years of life in India, but it's not enough. There's some strong candidates in the pipeline, the vaccine pipeline, and so there's some promise there that hopefully in the next few years, those can be part of the toolbox in our fight against TB. But at the moment, there's major funding gaps, and we need a real big commitment to TB research and development, and specifically some focus on the vaccines.
Sorry to interrupt. That was my
No,
question.
no,
It's just someone, I don't know if you know, but how, like, I'm not a biologist, like how come it works for children but not adults? Like how's like if we would get it again as adults, then it just wouldn't matter?
Great question. I unfortunately am not the best person to answer that one as well. I'm not really sure why exactly. But I'm happy to look into that and share with you all to share with the participants afterwards. But yeah, I don't know why exactly it's ineffective as we age.
I could probably jump in.
That'd be great.
My sister's a doctor, and sometimes we just talk about things like this. And I think one of the biggest things when it comes to talking about vaccines, from my understanding, is that there's a cost and benefit to everything. And the BCG vaccine, from my understanding, is one of the live vaccines. So when you vaccinate a certain demographic that's really vulnerable to them, like children, for example, there's more pros to it because they're more likely to get it, they're more likely to die from it and things like that, versus like the older generation, they respond better to antibiotics, as far as I know, or like the treatment to it. It's not necessarily antibiotics, but the treatment to TB versus like children don't really respond as well to the treatment to TB, so they can end up dying from it a lot faster. That was my understanding of it, because there's like risks and benefits with everything. And I will say one thing that I've heard is like there's not a lot of funding for this, because TB unfortunately isn't very common in the States. It's common more in like outside countries, countries that are considered like, I guess, like developing countries that are just more exposed to things like this. So if a lot of people, for example, in the US don't really have something that's affected, don't really have like something like TB, it's really hard to get funding for things like that, even though it affects a significant amount of the world's population, just because like a lot of the investors in the US are more interested in funding research that will help a lot of citizens in the US versus like global health. That's my understanding of it.
Yeah, that's definitely a big part of it. So I appreciate you sharing that, and that's going to be a really good transition into the next slide and what we'll talk about. And then also, yeah, happy to. I'll look a little bit more into the BCG vaccine and the lack of effectiveness. Efficacy when it comes to adolescents and adults. And there's definitely more as well to it than what we've discussed so far. So, but I really appreciate you jumping on and encourage that from the rest of the participants if things come up, and feel free to also share your input over audio and video as well. So, so next slide, please. So this gets exactly at what was just mentioned. So as you know, TB remains the world's deadliest infectious disease. There's even more challenges than there were a few months ago. And so this is the problem that we face globally in the fight against TB, and next slide, please. And then this graph will give us a view into some of the global challenges that we see. And so here we've got TB incidence, and then we've got GDP per capita. And so what, I wanted to ask you all, I think we've already started this conversation on this. What do you read here? What do you think might explain this relationship here, and what are the drivers of TB? Any thoughts from the audience? Feel free to comment, feel free to hop on. I'll just wait a couple more seconds, otherwise okay, excellent, thank you. Access to preventative care increases with, that's right. So that's a great point. Access to treatment options is also another reason. Access to diagnostics, and especially in countries, areas with limited access to healthcare, there are places that, think about rural communities or places where there just isn't a health center that's accessible, or it's just miles and miles away. It's hard to reach the health centers, and it's hard for healthcare to reach the people that most need them. So that's one of the reasons, and so those are some of the challenges that we see. And then as far as thinking about what are drivers of TB, and some of the things to consider are malnutrition, crowded living, and living and working situations, environments, places with not the best air ventilation, diabetes. These are all also drivers of TB. And so there's a link and connection to poverty But also it's important to understand that TB also recreates and exacerbates poverty as well. So when you look at catastrophic costs, so people that experience loss of families that have a loss of income of 20% or greater, about half of people with TB and their families experience that catastrophic cost, and that number jumps to about 80% when you look at drug-resistant TB. So next slide, and try to move through a little bit quicker on the rest. So here's something that we had discussed a little bit about the challenges. We're just not able to reach all the people that actually have TB and make sure that the healthcare is getting to the people that need it most. And so people are going undiagnosed. And so this past report that had come out last year on 2023, we have 2.7 million people going undiagnosed in that year. But in a different way to look at it, it's a record high amount of diagnosis of about 8 million people. So it is successful. In order to end TB, we need to find TB. So next slide is on treatment options and the need to improve them, to make them shorter, make them safer, make them less toxic. And there's been a lot of great progress in that over the past decade. We've got regimens cutting treatment process to 6 months, 4 months, and even 1 month, 2 months for preventative treatments. So there's great progress there. We just need to make them accessible. And so one of that challenge is related to funding gaps that we'll see in the next slide. So it costs about 22 billion to provide universal health access for TB. And Karyne, could you go to the next slide, please? We just don't have the funding available with only 5.7 billion. All right. And so let's jump and talk about, I think Karyne's might have gotten disconnected.
Okay. In the meantime, Tencent, we do have a comment in the chat. I'm gonna reach out to Karyne right now.
Okay. Okay. So, okay, there we go. We're back on. So yeah, there's the funding gap that I mentioned. When I get the chance, I'll go through that comment as well. I'll keep moving forward with the presentation for now. And so jumping to the conclusion now, the solution. So we had discussed a little bit about the Global Fund. And when we have this video, but I think we can skip that video for now. We'll finish up with there's one video at the end that I wanted to share. So next slide, please. So Global Fund is one of the best tools that we have in fighting these 3 diseases, if not the best. Global Fund is a partnership that raises funds every 3 years. There's a cycle, a fundraising initiative, and this is the replenishment year to build up and generate the funding for the next 3 years. And so the next 3 years, there's an opportunity to save 23 million lives. We want to rebuild the health systems and build on the progress that we've already had over the past 2 decades, and even beyond, thinking about vertical disease programs, helping to build health systems that are sustainable and are able to reach the people that are most in need, and be able to do it in a way that centers communities and ensures impact. But yeah, we'll get through the next few minutes and then let's have a discussion. So I'll just kind of chat through and provide this overview of Global Fund and see. Karyne, should we just go without the slides or?
Yeah, I was pulling it back up. So on
Okay.
the key treatment and prevention interventions, was that the
Where
where we had left off? Sorry about that.
Oh, yeah, we can just jump to the key results.
Okay.
Okay, so yes, overall, there's been so much progress in the past 2 decades, plus decades, and that's 25 million people on ART, 7.1 million people. This is just for 1 year, for example, in 2023, and 227 mosquito nets distributed, protecting against malaria. And the next slide, I wanted to provide an overview of what makes Global Fund special, and quite different than maybe some other global health institutions. And so this is an overview of what is all involved in making this happen. And so what you see is this cycle of every 3 years of the pledge and the grants being carried out. And so that's what starts it. And then the countries and communities make the plan. So there's a country coordinating mechanism. And think of like a small committee of about 15 to 30 people. And they're the ones writing the grant proposals. They represent various sectors within the countries. And they design the programs, they lead the work, and they are the ones responsible for ensuring impact. And so this is quite different, where it's not a global health institution that is carrying out the work and just telling people what to do, but it's really the local leadership, the investments and commitment from local governments, ministries of health, and all coming together, civil society, various sectors, to use their own expertise at a local level for change, and with great expertise on their local contexts and the skill sets that they bring forward. And so that gets approved by the Global Fund, and then they lead the programs. And so something also important to note, that in terms of Global Fund, the secretariat operations and overhead costs are very minimal, at about 6% of all the funds. And so the vast majority goes directly to the countries and the programs that are being implemented. And so this process has resulted in millions of lives saved, and improving access to health in many low-income countries. So next slide, please. And these are some specifics on TB and some of the progress in minimizing TB deaths, and also the TB incidents. And so there's a few reasons why. I'll just really quickly emphasize that, one thing is the innovations that you see in diagnostics, and that's making new innovations available, and reaching rural and oftentimes marginalized communities. And another, you can go to the next slide. I'll provide an example of, so this is a gene expert machine that helps diagnose TB. Global Fund and other partners have helped secure a price reduction when it comes to test cartridges. So that's something else. And then here's an image of a computer-aided detection for X-rays and TB. And so this is using AI to help detect TB in very difficult to reach. And this is in Pakistan, and a coal mining community. And so this is actually a program that's been cut at the moment, and hopefully will be restored at some point. Next slide, please. And this is an image of what the warehouses are like, and how all the the supply chains, and there's so much that's interconnected within health systems, and different parts fund different things. So the abrupt withdrawal is really concerning. And then let's go to the next slide. I think we can just kind of fast forward. I want to make sure we can talk. And so this is a little bit about the replenishment cycle. The aim this year, next slide, is 18 billion in this pledging conference that will come up later in the fall. And so for the US, there's a 1 to 2 match. So every dollar that the US pledges there's a matching of the non-US funding of $2. So that would unlock more funding, and so to incentivize more pledges. So next slide is the goal. And then the next few slides will kind of guide us through what that looks like. So $2 billion in this upcoming fiscal year, 3 years, 3-year pledge means 6 billion. And so that would unlock 18 billion total. And lastly, when we think about our call to action, this is a really important year considering all that's at stake. There's incredible progress that's been made over the past 2 decades on these 3 diseases. And these are 3 diseases that are preventable, they're curable, and there's the persistence of them is just an example of a lot of the injustices that exist within health around the world. And so doing our best to eliminate these 3 diseases is just one way to fight against poverty, fight against inequity and injustice in the world. And we can do that with our efforts and our advocacy. And so to close, I wanted to, maybe we can just jump to that John Green video, and then we'll have 10 minutes for questions. So there's a book that was just published last week, Everything is Tuberculosis, by the author John Green, who is an exceptional and really incredible TB advocate, and especially at this crossroads that we're in globally, he is reminding us to stay hopeful as well. And so let's close with that, and then we can have a little bit more discussion. Thank you so much. Thanks, Karyne.
Temporal range, and you wrote, such despair only worsens our already slim chance at long-term survival. Apply that sentence to your worldview about the story of tuberculosis as you see it now. Do you see it as one where improvements can be made? Do you make grand claims about it relative to your overall worldview about how intractable problems like this can be addressed?
I know intractable problems can be addressed. The year I graduated from high school, 12 million children died under the age of 5, and last year fewer than 5 million did. That's one of the greatest accomplishments in human history, and it wasn't natural, it wasn't inevitable. It happened as a result of millions, or billions if you count taxpayers, of human beings coming together and working to make the world safer for children. We can do that with tuberculosis, we can do that with other diseases of injustice like malaria and HIV as well.
As a novelist, this is a nonfiction, but it's narrative nonfiction.
Yeah.
How was that experience different? Did you feel like Henry was in the, in the sidecar next to you as you were writing? Did you feel a greater burden because in part you've got another real human's life that you're telling stories about? How was the act of writing different?
Well, it is inconvenient not to be able to make things up, for sure. I sometimes wish I could, but in another way, it's very fulfilling. I mean, the truth is Henry's story and the story of his mother and the other stories I tell in the book are so astonishing that you couldn't make them up. To me, the nonfiction version of the story is as astonishing as anything that I could have ever invented, and so I didn't feel the need to write fiction.
Will you tell me the story of what happened with Johnson & Johnson and the tuberculosis drug that I'm not going to try and pronounce because I'll get it wrong?
I call it bedaquiline, but I don't know if I'm pronouncing it correctly either.
It will be bedaquiline for the purposes of this conversation.
Great. So Johnson & Johnson, using mostly public money, developed a new drug for tuberculosis called bedaquiline, which is a very powerful drug, especially against drug-resistant tuberculosis, and a really key tool for us. But unfortunately, it remained far too expensive for many people in poor countries. And so Johnson & Johnson, when they tried to extend their patent to create a secondary patent, a lot of people came together to say, that's unacceptable. We need lower prices and generic competition for this drug now. And as a result of all those people coming together, J&J eventually abandoned all of their desires for secondary patents. And now the price of bedaquiline has dropped by 55% in 1 year.
You had pushed Johnson & Johnson, and I wonder whether in that case you see maybe some hope for what this book will do as well in terms of changing policy.
Yeah, I want to be clear that I was a very small part of that story. I'd like to portray myself as the hero, but I really wasn't, unfortunately.
Well, as you write so often, the heroes are often the result of multi-layered historical forces that get there.
That's exactly right. And so this was really the result of a virtuous cycle that took many, many years. That said, it does give me hope. I think despair is very tempting. And despair is very tempting right now for a lot of people, and I absolutely understand that. The problem with despair is all it makes is more of itself. All despair tells us is not to get out of bed in the morning, not to fight for a better world. It's easy to feel like this is the end of the story, and it's easy to feel very discouraged. I feel discouraged in this moment, but this is not the end of the story. This is the middle of the story, and together we fight for a better end.
John Green, the book is Everything is Tuberculosis. Thank you.
Thank you so much.
Great. Thank you so much for your attention. Thanks for bearing with some of the technical difficulties. And at one point, both of us were logged off of Zoom. But yeah, I would be happy to answer some questions. And I know, especially towards the end of the Global Fund part, had breezed through some of the content. So any questions there, please do let me know. And Karyne, is there anything that you wanted to add as well that feels important that might have been missed?
I just wanted to thank you, Tenzin, for sharing your story. I think a lot of times when we're reading about these situations and these diseases, we don't have that perspective of what somebody can be going through. So thank you for sharing that perspective. And yeah, I invite all of you to ask some questions. I know there were some comments in the chat around the time I got booted from Zoom, so I apologize for that. And I saw that Natalia did have a question regarding how many times you can contract TB. I don't believe you're immune to it once you've had it, and it's something that definitely can reoccur.
That's right. Yeah, it can reoccur, but also if you go through treatment, you can live a normal, healthy life and go back to work, go back to living a healthy, happy life. So, so that's also important to note as well. And there is more and more research being done on post-TB experiences for people affected by TB, and how that can potentially impair quality of life, and also side effects that are adverse and can cause irreversible damage as well. So a great question.
Thank you. And is it, I don't know, maybe it's a silly question, but like if you contract it again, is it like, I don't know, like less bad or like, you know, if you get it the second time or the third time?
Oh, that's a good question. I actually don't know the answer if it would be necessarily worse or easier to get through. So yeah, I'm not sure. I'm gonna look into that one. I think one thing that I didn't mention is, well, there's no questions at the moment, and there was a question earlier, but I totally lost my comment, so I don't know what that might have been. But I'm thinking to mention that of all international funding for TB in particular, Global Fund amounts to 76% of that international financing for TB. So it makes it incredibly important to be able to secure the resources during these kind of pledging and fundraising opportunities. And that number is actually quite high for malaria as well. And so we really this program makes a big difference, and we'll think that's why we as Results have made it our top campaign for this year to ensure a strong pledge from the US. That's something I did mention.
I do want to add to that. It has been, and which is why if those of you are joining us for the second time, you'll notice that we did speak about the Global Fund sort of as an introductory presentation back in November. But since in light of the cuts around foreign aid, again, this is something, the Global Fund is something that's been supported on a bipartisan solution by many members of Congress, and Congress is a mechanism through which we can ensure that this support continues. Given the fact that, 83% of programs were cut within a matter of weeks, there are some exceptions that have been happened, but there is such confusion around waivers, around which countries are falling into the exception of the waivers, around which programs can resume, that in sort of a higher order of priority is really informing that environment through which we advocate for foreign aid. As I mentioned, it was a very small percentage of the US budget. And where there was reform needed, we have advocated for those reforms as well. So we definitely will continue with strong support for the Global Fund. There's actually, we didn't have too much time to go through in detail, but there was part of the Global Fund site, something called the Data Explorer, which actually gave the amount of money that went for specific programs, which programs were funded, which reports. So it's that level of transparency that we feel it's needed with anything with taxpayer dollars. But the devastation of suddenly withdrawing from these programs is really being felt. So it's something that we can hope that we resume on a larger scale, and then especially for the Global Fund as well. I don't know if we addressed the comment earlier around when I got booted about, I think it was about programs in South Africa.
I wasn't able to read that one since I lost that chat. Do you remember what it was?
No, I'm not sure if they
Related
could
to repost.
repost the comment or unmute. I know we have only a few minutes left, but I wanted to address
Yeah.
the slide questions.
So in the meantime, we do have another comment as last question, similar to the previous one, and this is more on the access to aid. So the student is interested in understanding your perspectives of how the discourse surrounding aid often obscures the wider picture. So how it hides the patterns of extraction that is actively causing the impoverishment of the third world today and actively impeding meaning on developing countries.
That's I think I mean, thinking about the long history of aid and relationships also with countries, and I think it's easy to also make the connections to aid that has been that's rooted in colonialism as well, but thinking through what kind of aid is genuinely impactful and helpful has been the approach, and especially thinking about it in the way that Global Fund partnership does it. It makes a really good case for what that kind of aid looks like when it centers the communities and people that are most impacted, and that they're the ones, that community, that country, the implementing country gets to guide that entire process and lead that process. And that's the benefit, especially for aid that is done in a multilateral way. And so there's great benefits to that type of aid, but also, I think there's lots of critiques around potential critiques to aid in some sense, but certainly the abrupt withdrawal of aid is incredibly concerning because you've got entire health systems that are, even one part of it that can be obstructed and hindered can really impact the entire health system too, given how the health systems are functioning in many settings. And so, yeah, I think it opens up a whole nother conversation that would definitely be interested in talking through more. But as far as I think, especially as somebody who represents affected community and civil society, the Global Fund is certainly one approach and solution that where that impact and the centering of people's experiences is really embedded throughout their values and their approach to the work. And you can see that in even the board, who has seats at the table, how decisions get made, and who carries out the work. So there's a lot.
We reached already the 1:30 mark. I just want to be respectful of your time, and also in case the students have to leave. But I wanted to thank you and also Karyne for your partnership and also for all the work that you do. Thank you, Tencent, for sharing your story, for creating awareness on tuberculosis and kind of advocating as well for aid and the different projects around the world. We really appreciate your time. I did get a question in the chat about if you can watch the recording. Absolutely, yes. We do have the recordings for all the TTR sessions at go.fiu.edu/TTR YouTube. The results also presented in the last series. So if you would like to also watch that recording that Karyne mentioned, you may access it in there. But thank you so much, everyone, for coming. As a reminder, the last TTR is going to be next week. We're going to have a conversation with the Institute of Environment on the FIU Aquarius base. So join us next week again for the last session of TTR for this series. And thank you once again to Tencent and Karyne for joining us and moderating this session.